According to the CDC, 3 million Americans live with epilepsy, and nearly 200,000 people in the United States will develop this condition annually. That is 1 in 26 people that will be affected by epilepsy in their lifetime. Hi, my name is Lisa Harrison, and today I am going to talk with you about epilepsy, the causes of epilepsy, different types of seizures, and treatment options that are available. My son was diagnosed with epilepsy at the age of 11 in 2018. I did not know much about epilepsy, so I joined a nonprofit support group called New Mexico Education and Support Services, and I am currently a board member and have been a board member with them for the last 4 years. So what is epilepsy? According to the WHO, the World Health Organization, epilepsy is a chronic, non-communicable disease of the brain that affects people of all ages. It is also a neurological disorder marked by recurrent, unprovoked seizures, according to the Mayo Clinic. Seizures result from abnormal electrical activity in the brain, which can happen to anyone regardless of age, race, or background. So causes of epilepsy. Some of the causes of epilepsy are brain injury or trauma. That can be from accidents at birth or birth complications. There is also a genetic predisposition, inherited conditions, infections such as meningitis and encephalitis, and abnormal brain development. Sometimes the cause is unknown. In my son's case, he has epilepsy and we don't know why. So types of seizures. There are focal seizures and there are generalized seizures. Focal seizures are a seizure that affects a certain area in your brain, and generalized seizures will affect all areas of your brain. Some symptoms of seizures: staring spells, lip smacking, eye fluttering, arm and leg jerking movements, loss of consciousness or awareness, and unusual sensations of like smell or taste. That is called an aura. An aura is actually a focal seizure itself, but it's a warning sign that a bigger seizure is about to happen. So you can get diagnosed with epilepsy through a history and physical examination. There's imaging such as an EEG, an MRI, or a CT scan, and most epilepsy is managed by medication. There's lots of different types of seizure medication, and with a specific medication chosen based on age, lifestyle, and your type of seizures. Some patients need more than one medication for seizure control. Other treatment options. Surgery. Surgery is removing the seizure focus in the brain. If you have just a specific area of your brain where there's just a focus, they can go in and remove that. You can also have a VNS implant. That's a vagus nerve stimulator. And that goes in and it sends electrical impulses to your brain. They wrap a coil around your vagus nerve, and it can control your seizures. There is also ketogenic diet. It's a high-fat, low-carb diet that aims to put your body in ketosis, and no one really knows why, but it helps people with seizures gain control of their seizures. CBD oil is another one. CBD oil, they're not really sure what the benefit is, but it has shown to help people with seizure control. So that is something that's being researched further. In conclusion, you've been informed about epilepsy, the causes of epilepsy, and the different types of seizures and available treatment options. So my message to you is this. In conclusion, November is Epilepsy Awareness Month. So this means that do what you can to support your epilepsy community. If it means sharing your epilepsy story, if it means learning more about epilepsy and seizures, if it means wearing some purple swag around your family and your friends, and coworkers, or if it just means supporting somebody that you care about. Whether you choose to do something big or small, it really does count. Thank you.